A good candidate for cervical disc replacement would be anyone between the ages of 21 to 67 who has neck pain, arm pain, numbness, tingling, weakness, headaches, that has not responded to physical therapy, epidural injections, or other forms of non-operative treatment. It's pretty much the same initial operation as a cervical fusion. Make an incision in the front of the neck, take out the entire disc, and then replace with an artificial disc. But it's easier to insert than the standard disc replacements. It doesn't require you to chisel the bone or put any screws in the bone to hold it in place. Well, the disc replacement is beneficial to the patient for the main reason is that it maintains movement. We know that when you fuse the cervical spine or fuse any spine, you eliminate motion at one level. The other discs have to move more to take up that stress, and they wear out faster. If you put an artificial disc in place of the fusion, you maintain movement, you prevent the wearing out of discs above below the fusion. Usually the neck pain is a little bit better right away with the arm symptoms. Numbness, tingling, weakness, pain is immediately resolved. Within 6 weeks, usually back to being fully functional.